I'm with the Black Nurses Consortium. I'm the founder and the president. I am also a licensed practical nurse for the state of New York and have been so for the past, what's this, 2020? Yeah, this is 2021. 9 years. I do behavioral health, meaning I serve the homeless, um, the mentally, I wouldn't say mentally ill, but people with mental health disorders and people with substance use disorders because they are the least served and they have the most problems. So that's where my niche is as far as nursing is concerned. And actually looking forward to going forward. I would like to be a social worker because, again, we need help with mental health issues within our communities. Is something that is sorely lacking. And then I'm going to segue into that with I'm glad to be a part of the Juneteenth family, especially dealing with Kwanzaa. So as Kwanzaa has 7 principles associated with it. And I was asked, could I do a presentation? And I asked, could I do a presentation concerning the 7 principles and how they connect with healthcare within our community. So that's what I'm going to do today. Now, I'm going to try my best to fit this in up until 3 o'clock because unfortunately I have another Zoom going on after that. So hopefully I'll be able to cover as much as possible. So with that being said, can we go to, I did send in my PowerPoint. So yes. So let's talk about the 7 principles. They're unity, self-determination, collective work and responsibility, cooperative economics, purpose, creativity, and faith. So that's just how it translates into English. It's Umoja, Gulia, Ujima, Ujamaya, Naya, Kuumba, and my favorite, which is today, Imani. That's what I named my daughter because it's faith. Now, I'm also going to add in some aspects as far as what we're dealing with this particular acute pandemic, which is the COVID-19. Now, our community suffers from several chronic pandemics, hypertension, diabetes, mental health disorders, substance use disorders, classism, racism is considered a healthcare condition, poverty. But in the light of what we've been through from I would speculate 2018, because there were some people who were getting sick in December of 2018 that they were just being diagnosed with upper respiratory infections all the way into we hit 2019 and it just imploded by March. So I'm going to talk about that when we get to the last principle and how that affects us. But that being said, can we go to the next first slide, please? So Umoja means unity in Swahili. Swahili. Y'all have to forgive me because I'm a city girl. I was raised with my family from the South, so I have a twang. So if you have any problems with enunciation, please let me know. Unity in the family, community, race, and the nation. How does that apply to healthcare and the healthcare that we in the African American community are in desperate need of? Well, number one, we should be able to apply as a united front to demand the healthcare that we so rightly deserve. As it stands right now, healthcare, your health insurance is contingent on employment. I'm not saying that we should have a socialist type of government for those people who are into political ideologies and things of that nature. But the government does have insurance, it's Medicaid and Medicare. The problem is, do we all in our community have access to health insurance? It should not be a privilege, it should be a right. And that being said, again, with healthcare, how is it being delivered to our community? How is it being done in a culturally sensitive way? And be mindful that there are healthcare practitioners and providers that have their own implicit biases, meaning They have their particular ways that they expect a particular race, ethnicity, or culture to behave. And instead of going in with a blank slate, they implicitly attach that to every particular person. Say, for example, every Black woman should be strong. She doesn't need any pain relief. When I'm talking about Black women maternal health care, because I know, and there's police, maybe some more sisters on here who can testify. When you're in labor, it's no joke. So when you raise your hand to say, I'm in pain, can you help me out with this? Sometimes we're just left there. You're not in pain, you don't need anything, you can handle this. When we are post-op from any type of surgical procedure, particularly if you have a past history of substance use, it's assumed that you just want to get high. So we're not going to give you the prescription that you need. We're just going to give you ibuprofen. For somebody who's had a knee replacement or a hip replacement, ibuprofen is just not going to do it right then and there. Now, that's not to say if there has been issues in the past, you're supposed to address that in a team-like manner to say, how can we make sure that the patient gets the right pain management they deserve? The basics of access and availability to healthcare. How many of y'all have as many health clinics in your community as you have the fried chicken spots, a bodega, a liquor store, or a funeral home? You don't have to answer that right here and right now, but you can look around in your neighborhood. Some of us where we live, we have an even, when I say even kill, you might have a few clinics, few private doctors where they hang their shingles outside. You might have some pharmacies. You might even have some urgent cares. You might live in close proximity to an acute care facility, which is known as a hospital. So you don't have that problem with access and therefore availability. But there are others in our community who have that, who literally do not have car fare to get there. There might be one, it's overcrowded and therefore understaffed. There's not enough pharmacies in the neighborhood. And if there are, they're being charged ridiculous prices. That leads to a particular place where people are apathetic about this is the way it is, this is how it's always going to be. We have to unite to come together to affect that type of change. Now, whether it is by, the pen, P-E-N, is mightier than the sword. You get a right campaign, you reach out to your elected officials, you go on social media, you demand these things. You go to that nearest healthcare facility and you ask them, what can you do to help us get the care that we need? You can even lobby your insurance company. Insurance companies do not like people who we consider high utilizers of their resources, meaning you're so sick you're using up everything they got because they don't want to spend money. So that being said, we have to be mindful that some of the practitioners, if they have their own implicit and bias, will not give us the necessary tests, diagnostic ones that we need. So in my personal experience, I had to go to 2 other doctors before I found the right doctor who said, I don't think that you should be suffering with this type of GI disorder. But why in God's green earth would they prescribe you medication before they had the necessary diagnostic tests done? So he put that in. This is a white man, and made sure I got the right diagnostic test for him to say, no, you don't have anything wrong with your gallbladder. No, I don't know why they need to do an invasive test. You just have acid reflux. I'm gonna help you change your diet so moving forward, you won't have these problems in the future. So that's what I mean by unity and how we could come together and demand the type of care and respect and the culturally sensitive treatment that we deserve. Next slide, please. Now, Kuji Chagulia means self-determination. So I will say this. There's nothing wrong with speaking up for yourself, for advocating for yourself, and for the community. We have been told that we're combative when we speak up, or we're the troublemaker. We just stir up. The old folks you just stirring up trouble. No, I'm not stirring the pot. I'm trying to bring it to your attention that patient or client-centered care needs to be in the forefront. Meaning, if like the cell, I'm the patient or the client, I'm the nucleus, and all the other parties around, or the mitochondria, they are on the team. I am the center. I have my doctor, my nurses, my dentist, my social worker, my pharmacist, my pharmacist, whatever other team members on that team. I have the right to say, let's combine our thoughts. This is the situation. And you ask to be educated to make an informed decision about the type of care needed. And it is the assumption by quite a few healthcare practitioners that we are an afterthought, that we need to be told after they make the diagnosis and after they do the care plan. And then for some people to just sit there instead of, they're either afraid or they're not being taken seriously. Now, there's a video going around on social media about the doctor who died. That's a doctor. It's a Black female doctor who is advocating, okay, self-determination, say that I'm not receiving the proper care. And I'm basing it at the end of the day on some type of implicit biases or discriminatory type of thoughts that the provider is having, because she was suffering from COVID-19 and she did not receive the care that she did. And by the time she did receive the care so needed, it was too late. But the hospital response, as they sent out the press release, was maybe some of the staff felt intimidated by the doctor. Yeah, that is some of the things they will say about us, because we have the nerve to use our mind to speak clearly, to advocate for ourselves. So at the end of the day, do not be afraid to advocate. If you don't get the right answer, go back and ask another provider. Reach out. You can utilize the internet. And I'm not talking WebMD. If you have questions about something, you can reach out to the CDC's website. You can reach out to the National Institutes of Health website. If you don't like that particular doctor, you feel that they're not working for you, you have the right to choose another provider. It is not etched in stone that you're supposed to be with that person forever. So please continue to advocate for yourself. Sometimes that squeaky wheel, it does get the grease. You squeak on. Sometimes I tell people, maybe a little honey do a little better than vinegar. However way you do it, you must advocate for yourself, because no one else knows what's going on with your body but you. Next slide, please. Ujima, collective works and responsibility, meaning how we work together to find the problem, to solve how we solve it, and then how we're able to do the deliverables. So that being said, for example, if you live in a, what they call it, food insecurity area, sometimes they call it a food desert. Sometimes it's called a medically underserved area. And I'm not talking about in the rural population. I'm talking about in what is called an urban setting. So again, if you notice, you have more bodegas, fried chicken spots, Chinese food spots, liquor stores. You don't have enough doctor's offices or urgent care or pharmacy. You're in a particular area that's not being serviced. And if the community can see that problem, number one, how do we address it? Again, let's advocate for ourselves. You need to reach out to your fellow elected officials. You need to reach out to the other healthcare facilities that might be in or near the area. Sometimes they would like to come in, but they don't know how to come in. If you come together as a team, make a committee. You need to have your voices heard. Black Lives Do Matter, that includes with medicine. If you have to do a silent protest, a letter writing campaign, a social media campaign, then do whatever you have to do that is legally necessary in order to bring to attention, this is the problem. And sometimes when you address the problem, sometimes you have to do it in dollars and cents. If we had the proper medical facilities in our area, The community will be able to use them as opposed to going to a hospital. So there's less money spent by the insurance corporation and more money spent at the particular doctor's office or center. And then we move into preventative medicine. And in doing so, that's how you're able to deliver the necessary healthcare needed to the community. So that's what I mean by a collective works and being responsible. We all are in this together. And if we don't say nothing, our community will eventually disappear. Next slide, please. Maya, y'all have to excuse me. Cooperative economics, meaning how do we uplift our communities economically? There's enough money in the poorest communities to shed light on how we, with little or no funds available, can do certain things for the betterment of our community. For example, if you have nonprofits like your church in your community, they can reach out and receive grants at the local, state, and federal level, or a private donation to set up a pop-up clinic, to set up a mobile van that comes around. If we collectively pool our monies together, you can set up a mini clinic right there in the church basement, even if they come around once a week, twice a week, whatever the case may be. If you can't set one up there, how can we pool our resources to ensure that all the people in our community, again, ride share? Some people don't have money to get to the treatment. It's not a problem that the treatment is there. I can't literally get to it. If I have to choose between car fare and eating, I'm not going. What we mean by collectively, how can we think in a proper manner? What can we do with the resources we have to get this type of care that we need? And if we don't have enough of the resources, how can we go out there and pull those resources in? Not just pull them in, but keep them coming in. Can you not have people volunteer to come in and do the services? For example, on Black Nurses Consortium, we work with quite a few organizations. We've worked with churches. We've worked with schools to come in, do testing, do education. Sometimes you just need to do one turning of the light bulb on to spark the thoughts of what we need to do for our communities. So that's what I mean by how can you economically use the resources in your community. You have to start somewhere. Next slide, please. Naya, purpose. What's our purpose? What is our mission? The purpose here is the importance of health and wellness within the African American community. We as a community in the United States of America, we make up just maybe 30% of the population. Yet we suffer from the most amount of preventative type of illnesses in the United States. We should not be at the forefront of, say, being the first to be diagnosed with HIV. We should not be at the forefront with what I call diabetes, heart condition, and high cholesterol. We should not be at the forefront of our mothers dying in birth. Our culture is the one that all of the people in the world look up to. That's what we should be known for. So our mission is, how can we get this health and wellness, preventative care, and the resources we need into our community? That is our purpose, and that is our mission. Next slide, please. Kuamba, or creativity. So what are some of the ways that we can implement these type of necessary treatments, plans that we need in our community to at least get the ball rolling as far as how can we have a betterment of healthcare delivery systems? So can we not just think outside the box? Like I said earlier, why can't we have it done at the church? Why can't we have a pop-up done? Why can't we have, like, as we do, like, say, for Juneteenth, and I'm crossing my fingers for Juneteenth 2021, that we will be able to go outside. That's another way. Meet your client where they're at. If all my clients are at one particular festival or event, why can't we not create a way to deliver the type of services we need right there where they are? Can I not come to your home and provide you with the care? Can I not just come out and ask the community, how do you want these services done? You tell me, because if I can get the community to be a part of it, not only are they going to buy into it, but they're going to expect it. And they're going to tell us what's going to work, what's not going to work. That's what we mean. How can you be creative? How can we have an emergency or urgent situation the care we need right then and there? Why should we have to wait? So that's some of the things when I say, let's be creative. How can we get these systems started, implemented, and keep them going on a regular basis? So that's with Kuumba. Next slide, please. Can you hear? Oh. And my favorite is Faith, because that's my daughter's name. Faith, to believe in each other and in each person in our community. First and foremost, whatever faith, whether some people believe in a higher power, some people don't. That's your personal preference. We all must come together. We need to have faith in each other in our communities. And in the Black community or African American community, however way you want to address it, our faith manifests in our houses of worship and in the churches is like the nucleus in the cell. It is the core of our community. It springs forth where we're educated how to read, how to write. That was how our ancestors learned how they were self-taught, how to read and how to write. Learn how to read the Bible, learn how to recite, learn how to write, teaching the others. The same principle. How can we at least let's bring the healthcare to the church? Before we have service, how can we have people tested for their diabetes or the cholesterol? Or, for example, COVID-19 testing. How can that be done before the service? Can we do it after the service? Can we do a teaching about it? Remember, it's at the center of the community. Can we not, again, have some type of services, say in the basement, in the rectory, in the temple, in the synagogue, wherever you go to worship? Some people, if you go and worship in a home, in the basement, again, how can we use the church to utilize the resources we need to deliver to our communities of color to the health care that we need? Because not only do we need emergent and urgent care, we also need preventative care. Some of the conditions that we see our loved ones suffer with, they're preventable. No, sugar ain't hereditary. It's just not. High blood pressure, my pressure, not pressure, my pressure. No, that ain't hereditary. Some heart conditions are congenital, meaning they're hereditary. But that's few and far between. Other things we can take care of. You don't have to be rich to eat well. You don't need high fancy sneakers. You don't need gym membership. We used to go for walks after dinner. We used to go walks after Sundays after service. You could go on walks in your neighborhood. They're free. We need to get back to that mentality. But again, we need to ask our houses of worship to help us do that. Because as it is said, faith without works is dead. So you can have the faith, but you don't put the work in, what's the point? So I believe that we should, again, I think underutilized, but in every community, as the church and the houses of worship are the core, so should they be at the epicenter of how we can address the health and wellness that we so need in our community. And on that note, that is the finish of my 7 principles with Kwanzaa. However, I will move into the elephant in the room. And as you can see here on the last slide, this is the ways that you can reach out to me. You can reach out to our website at www.blacknursesconsortium.com. Our email is blacknursesconsortium@gmail.com. You can reach out to me on my social media pages. I'm on Facebook and on IG. And on Facebook, we're the Black Nurses Consortium. And on IG, we're the Black Nurses Consortium, one word. I'm going to talk about the COVID-19 disease itself. And as you all are aware, the vaccines rather, that had the EUA, Emergency Use Authorization, by the FDA, which means instead of going through the regular trial and process of getting approved, it was advanced and they were given an emergency use authorization. So the first one was Pfizer and then Moderna. Both of these have two doses to them, meaning, for example, like when you paint your house, you need the primer, that's the first coat, and then that second coat, the same principle applies with these two doses. Pfizer, you get the first dose that tells your body we're introducing this particular vaccine, and the red alert comes up. 28 days later, you get the second dose. So most people who are feeling the side effects, is what they call them, from the immune response of the body, they're saying it kicks in on the second dose. Moderna has 1 and 2 doses, they're 21 days apart. AstraZeneca was approved by the UK, and I expect them to be approved by the United States. They also have a 1 and 2 dose. The United Kingdom is using AstraZeneca, and their mission is to dose everybody the first time around, as many as we can get. We will space out the second dose later. We want to ensure everybody gets a vaccine. Johnson & Johnson has a vaccine in the works. It's 1 dose. No, you're not going to turn into an alien, because there are some people who feel like if I take it, I'm going to turn into an alien. No, you're not going to turn into an alien. No, it is not a live virus. It is messenger RNA, meaning it works on outside layers in the cell and it helps with on the protein spikes. Yes, there are variant strains of the virus going around, and it is to be expected because viruses mutate. The cold virus mutates, the flu virus mutates. I'm not advocating that everybody should get it. I just want people to be educated and then make your proper informed decision to consent whether or not to take it. But if we as Black people make 13% of the population, we've had 16% of our Black population die from the COVID-19 virus. Now, there are a lot of factors involved with that, like access to care, lack of insurance, preconceived biases and notions, and the list goes on and on. The point being said, we have to make informed choices. But before we get to that, some of the things I want to leave you with. It is a virus. There's no antibiotic for it. Some people get it. I'm a COVID-19 survivor. I had it in April. I can tell you I got the call April the 4th, 2020, 8 o'clock in the morning, it's the standard time, that I was positive with COVID-19. The only reason why I got tested, because at that time they were rationing out the test. 10 months before that, I had pneumonia with a collapsed lung and ended up having sepsis. So it hadn't been a full year since I was fully coming around, and here I am with COVID. And no, my only symptoms were, it felt like a sinus infection. So that's to say everybody's symptoms are different. And then some people are asymptomatic. So when we say just get tested, just please get tested, please socially distance. We miss our loved ones. I did not see my mother till the day before she died. And I had not seen her before that until like January. And she died in May because I did not want to go in the house because, God forbid, what if she caught it? I was tested, I was negative, but you never know. Wash your hands, wear your mask, put the mask on your whole. I don't see, I'm gonna show you with this one. Sorry, y'all. I got a mask, but I got so many of them, y'all, like I'm in a warehouse. People put the mask on, it has to cover your nose and your mouth. You wear glasses like I do, try to do a tight fit, right? And when I'm at work, I also have N95 mask. I have N95 mask at my house. If I'm doing COVID-19 testing, then I put the whole suit on. But anyway, in general, when you're in the public, put your mask on. It should cover. Not this, not this, not this. Put it on. Is it aggravating? Yes, it is. Does it feel like your hot breath is kicking back at you? Yes, it is. Drink more water. Keep your mouth lubricated with natural water. If you want to use a mint, that's fine. Keep your lips with some lubricant ointment. Keep them moist. The point is, put your mask on. Wash your hands. We was little kids. Our mama used to say, when you come in the house, you bring in here all this dirt from the outside. Go in the bathroom, wash your hands. Before you eat, wash your hands. When you go to the bathroom, wash your hands. When you come out, it's not hard. We have hand sanitizer now. Use your hand sanitizer. That's socially distance. I mean, I tell people err on the side of caution. So we in the house now. We could come out later and all be together. We all have known too many people, our ages or younger and older, who died. And we always say the same thing. I talked to him and her yesterday. As it stands right now, have a few dear friends of mine who are in the hospital with the COVID, and it's shocking. So that being said, wear your mask, wash your hands, socially distance, be safe out there, everyone, because I would like to see all of y'all again here online on Facebook and at our Juneteenth come June in was it June 16th or June the 18th of this year. So with that note, I would like to thank everybody who was listening in. I appreciate the honor.